Hey everyone, ready for a deep dive. Today we're tackling iridocyclitis, and we've got an interesting medical text to help us out. Whether you're facing an appointment or just plain curious, we're going to break it down. No medical degree required. So first things first, what exactly is iridocyclitis? This text defines it as, well, it's a type of anterior uveitis, and that means it involves inflammation right there in the middle layer of the eye.
And that's a problem because we're talking about parts of the eye that are pretty crucial for vision.
Makes sense, yeah. Not something you want inflamed. Anyway, it goes on to say that iridocyclitis, it specifically affects both the iris, the colored part, and the ciliary body, which if you didn't know, helps your eye focus.
Right, so inflammation there can really mess with how well you see.
Definitely not good. Now, the interesting thing is, the text mentions there are actually three main types of this iridocyclitis thing: acute, chronic, and recurrent. It says acute iridocyclitis is like the most common one you see. And the good news is, even though it can be pretty intense while it lasts, it tends to be, thankfully, short-lived.
Yeah, acute cases, they can flare up pretty dramatically, but then often resolve quickly.
Okay, so that's the acute kind. Then there's chronic iridocyclitis. This one, from what the text says, it's like more of a long-term thing.
Yeah, chronic cases, those are the ones that can be trickier to manage. They really drag on.
But then to make matters even more fun, there's recurrent iridocyclitis, which, well, I guess the name kind of gives it away.
Yeah, recurrent means just what you'd think. It keeps coming back.
Like a bad sequel nobody asked for.
Exactly. Even if you think you're in the clear, it can reappear.
So we've got these three main flavors of iridocyclitis to worry about. But what causes this thing in the first place? So the big question now is, what causes this whole iridocyclitis thing? And the text, well, it doesn't exactly give us a straight answer.
It's often a bit of a medical mystery, figuring out the root cause.
Right. It's more like, here's a lineup of usual suspects. And first up, we've got these things called autoimmune responses. Basically, it's like your body's defense system gets a little confused.
Yeah, instead of attacking invaders, it starts attacking your own tissues.
In this case, the eyes, which is not great.
Exactly. And the text specifically mentions conditions like ankylosing spondylitis.
Oh, right. I've heard of that. But what does that have to do with your eyes?
Well, it's one of those cases where the immune system's confusion can end up triggering iridocyclitis.
So it's not just about what's happening in the eye itself. It could be a sign of something else going on.
Precisely.
Okay, so that's autoimmune stuff. But then the text also throws infections into the mix. And not just your run-of-the-mill cold either. We're talking herpes viruses, bacteria that can cause Lyme disease, even parasites. It's a whole smorgasbord of potential culprits.
It really highlights how interconnected our bodies are. An infection in one place can manifest in another.
That's a good point. Never really thought of it like that. And speaking of connections, remember that HLA-B27 gene we talked about earlier? Well, the text mentions it again here, suggesting it might be a genetic factor in some cases.
It's not a guaranteed predictor or anything, but it seems like researchers are looking into it.
Yeah, like a piece of the puzzle they're trying to figure out.
Yeah.
And last but not least, we've got the usual suspect in many health issues, smoking.
Not surprising to see that one pop up, given how harmful it is to pretty much everything.
Right. Another reason to add to the ever-growing list of why smoking is a bad idea.
Okay, so say you're listening to all this and thinking, uh-oh, some of this sounds a little too familiar. What's the next step?
Well, the text is pretty clear on that first stop, the eye doctor.
Makes sense. Got to go to the experts, right?
Exactly. And this is one of those things where early diagnoses can make a huge difference.
So catching it early is key.
Absolutely. The earlier, the better.
Okay, so you're at the eye doctor. What happens then?
Well, the text mentions they might use eye drops to dilate your pupils.
Right, to get a better look inside. Exactly, and then depending on what they see, they might do some more tests.
Like what kind of tests?
Could be blood work, maybe even a referral to a specialist, just to rule out other possibilities.
So it's like a process of elimination sometimes.
Exactly. They want to make sure they have all the pieces of the puzzle before deciding on a treatment plan.
Which brings us to, I guess, the big question: how do you treat iridocyclitis?
Well, it really depends on what's causing it, but the text does mention a few common approaches.
Like what, for example?
Steroids are a big one. They can help reduce inflammation.
Ah, so those are used for eye stuff too.
Oh, yeah, they can be given as eye drops or even orally in some cases.
And what about pain? Because I imagine having eye inflammation can't be comfortable.
No, definitely not. And the text does mention pain management as part of the treatment plan.
So there are medications specifically for that.
Yeah, it seems like there are options to help manage the discomfort while they address the underlying issue.
Well, that's good to know. At least there's something to help with that. This has been a fascinating deep dive. Really appreciate you breaking it all down with us.
My pleasure. Always happy to talk about eyes.
But before we go, any final thoughts for our listeners?
Just a reminder that we've only scratched the surface here. This medical text is a great starting point, but it's no substitute for a real conversation with your doctor.
Right. It's always best to consult with a professional if you have any concerns.
Exactly. Knowledge is power, but it's most powerful when combined with expert guidance.
Couldn't agree more. On that note, we're wrapping up our deep dive on iridocyclitis. We hope you found this exploration informative and feel a little more equipped to navigate the world of eye health. Until next time, stay curious and prioritize your well-being.